All right. So, welcome to our presentation today. Again, I'm Dr. Sharyl Truty. So, direct primary care, you're here to talk about it, listen to what it's about and why it might be a solution for you personally. I'm going to try to go through, what I think describes it as quickly and as succinctly as possible. And certainly at the end, if anybody has any questions that specifically pertains to them, please feel free to let us know. So what is direct primary care? And specifically, our practice, Balanced Physician Care, is located here in the Jacksonville, Ponte Vedra Beach area. And we service a very large, broad group of patients that extends way out beyond those areas because of what direct primary care is and what it's all about. So direct primary care is actually been going on for quite a while. I opened up my practice here, Balanced Physician Care, about 2.5 years ago. And at that point, there was maybe about 600 practices that were, currently across the country doing this type of healthcare model. And now it has grown to over 1,000. So this is not just something that, is something that we created here. It is a nationwide model of practice that's been growing. And why is it growing? Why is this something that you might be interested in for your family? Well, direct primary care is basically very simple in its definition. It is, a membership-based practice. For a monthly fee, you receive, a wide breadth of services that we provide here, and I'll detail those in a minute. But at any direct primary care practice, that's what you receive. And what sets it apart from concierge medicine is that usually in concierge medicine, the fees are much higher. And they also often can bill third-party payers. And so in this type of a practice, it still is a monthly fee, but we do not bill insurance. So we're able to eliminate the middleman, reduce overhead, and provide a considerable savings for our members. So again, it's a low monthly membership fee that includes all of your interactions with a physician. So, to understand the benefit, let's talk about what healthcare is like for most people. And then that will kind of help us to understand how direct primary care is in contrast to that. So for most people, direct primary care can be, for most people, healthcare can be, just a really difficult, experience. When you go to the doctor, it often takes you weeks to really get in. And, if you have a simple question, there's no way to ask just one simple question and get a quick answer back. You really have to be in the office to get answers to your questions. And so what do most of us do? We go to the internet, we ask our friends, we talk to other allied health providers, anything to avoid going to the physician's office because again, it may take us weeks to get in unless we go to an urgent care. But if we go to an urgent care, that often is costly, especially with co-pays, and self-pay rates. When we do finally get in to see the physician, I mean, we're often waiting 45 minutes to see the doctor. And then, once we get in, it really only spend about 10 minutes with our provider. And that really doesn't leave much time to go over, nutrition, to go over, a problem in depth and weigh, what you want to do, whether you want to see a specialist, whether you want to try a medicine. It just leaves you time to write a few prescriptions, referral, or order a test, and then, that's it. And if you've got more than one problem, again, you're either having to go back to the doctor's office multiple times and wait again, or everything is just handled very, very briefly. So direct primary care really asks the question, should healthcare be different? And our answer, to that is yes. We really believe that healthcare should be different. Um, so at the hallmark of direct primary care is really a good relationship with our patient. And in a direct primary care practice, we're not going to have a panel of patients that's 2,000 to 4,000. That's what most physicians or practitioners have at this point. Our patient base is going to be only 400 to 600. And what does that do? That allows us to really get to know you very well. And we can spend as much time in the office as we want to, or on a phone visit. And so we get to know you, your conditions really well, and understand them from a holistic perspective and from your own social perspective, and what is important to you in your life and how you want to handle your health. And we believe that leads to better quality of care. Certainly it sounds good and sounds nice to have a really good relationship with your doctor, but, does it lead to improved health outcomes, better quality? And, the answer to that is yes. There have been studies done, particularly one study by the British Medical Journal in October of 2013. This was published by practices out in the western part of the country that have been doing direct primary care for years. And they basically, kept track of the data, and they compared it to a regular practice. And they found that absolutely being a part of this type of membership led to 66% less emergency room visits, 35% less hospitalizations, and 82% less surgeries. So yes, being a part of a practice like that, while having a personal relationship with your doctor, just often makes the visits much more, nice and friendly and interactive and personal. It also leads to better quality of care. I like to say that this type of membership is about health care, just not about health coverage for catastrophes, but it's really about health care. But direct primary care goes beyond that, with more and more people having high deductible health plans, and more people having, to pay cash for their health care now. I think there's a demand for more quality from the consumers who are paying cash. And so direct primary care makes medicine more convenient for you. It strips away the barriers of regulation, it strips away the barriers of insurance and the rules that have to be followed and the hoops that have to be jumped through. And so we're able to make it more convenient for you. So direct primary care in a practice, I can see you no matter where you are. So if you travel, or if you live in another part of the country for part of the year, or even if you live in a different part of the city, and having this type of care means a lot to you, I am able to bring healthcare to you through the aid of telehealth visits, which is very similar to something like we're doing right now, or phone visits. There aren't those barriers, and it's your own physician taking care of you. And we're able to prescribe no matter where you are. So we really bring medicine to you. And patients don't wait in our office room. I mean, most people only wait at most 10, maybe 15 minutes if something is going on with another patient ahead of them. But there's little or no wait time. So it's able to fit into a busy lifestyle very easily. And then we really provide a lot of coordination of care. The system is difficult to work with, but we really try to take it up a notch in trying to be able to help coordinate care with other specialists, and really kind of give you a home base where you can get, different perspectives and be able to coordinate among the different people and specialists that you see. The third reason to look at this type of membership-based practice is for people who, besides the convenience, besides the personalized visits, they're really looking at cost. And so they need to try to keep their costs down because for whatever reason, maybe they have a high deductible health plan, maybe you choose to go without insurance, maybe you have a health share plan, and you really are paying cash for a lot of the services you need, whether they're prescriptions, whether that's x-ray, whether that's labs. We provide discounts on all of those things. So with a prescription, we're going to help you find the lowest pharmacy around. We're going to tell you where, the cheapest testing is available. I mean, and all of these places are quality places, and it's just really hard in healthcare to find price transparency, and that's our promise, is we're going to work with you and help you to have price transparency so that if you are doing a test, you're going to know what that costs are ahead of time. In our Premier model, we include all primary care visits and all procedures. In our basic membership, we include all that. We just add a few visit fees if you do come in here locally into the office. And then for our Premier membership, we offer a specialty consult service where if you have an issue that is complicated and, it's something that I, as a primary care physician, am able to handle, but might need a little extra expertise, we're able to work with a specialty consult service called Rubicon MD and get sort of a specialist overview to decide whether this is something we can continue to take care of or if we need to refer you out. So again, the idea is this is a one-stop place. Everything we're able to take care of here. If you want to see a specialist, absolutely you can. But if you like the idea of convenience and one person, sort of managing or keeping an eye on what other people are doing, this is definitely something worth taking a look at. So we believe at the heart of direct primary care is that medical care should be convenient, accessible, and personable. And that our goal should be to avoid unnecessary testing just because we have to get you in and out. Minimize medications, really talk about other options that you can use to solve a problem rather than just another prescription. And we believe it should save you time because time is a very valuable asset. And then we reduce cost, and we try to reduce cost by our price transparency and by eliminating the middleman. So a lot of people ask me, how does it work with insurance? How does this plan fit in with a larger insurance picture? So, this type of membership does not include, payment or coverage for hospitalization. So, if there is an occasion where you end up being, hospitalized, or you have a significant chronic disease diagnosis and that requires, ER visits or hospitalization, there are several types of coverage that you can use to sort of wrap around direct primary care. We look at this as a puzzle piece, and that direct primary care provides 80% of your everyday needs all in one place, and that you try to find, some options that will sort of wrap around that for the catastrophic, care that you might need. So direct primary care can really go with no insurance if for you feel you're healthy, you want to save money and just put that money away for a catastrophic event. Some people choose to do that. For other people, If you have a high deductible plan, especially if you're looking at, $6,000 and up, for most of the time you're paying cash. Occasionally on a year here or there, you might meet that deductible. Then this is, a affordable flat fee. And it gives you sort of peace of mind insurance, is what I like to say, for knowing that you have someone there for you all the time, so that if something comes up, you don't have to explain things. You can just send an email. You can just have a phone visit, and your doctor knows you well and is available for you 24/7. And again, that is one of the benefits of direct primary care. Some people, for those benefits, for that personalization, for the ability to have your doctor available for you 24/7, for the ability to just reach out an email, if you have an employer-based health care program, there's a lot of people who will still choose to use this direct primary care, again, to get that care and that quality component. There is one more type of health insurance, or I shouldn't say health insurance, but health care option, that can wrap around this, and that's called a health share. If you're interested in learning more about what a health share is, it's similar to an insurance, but not quite. It can be used as a catastrophic option. Liberty Health Share is the program that we often talk to people about because they support direct primary care. But we'd be happy to send you a list or send you some more information if you're interested in learning more about that as an option, in conjunction with the direct primary care practice. So, direct primary care often is a business solution as well. So for people who might be owners of a small business and looking, or if you're an employee of a small business, maybe this might be something you might want to talk to your employer about. This is a great benefit that, can often be used when people can't afford to offer health care. So to summarize, I like this slide. It kind of gives us a good summary about direct primary care. Again, for a flat monthly membership fee, you're going to get included all your primary care visits, any procedures that we're able to do. You're going to get access to the doctor all the time. On weekends or evenings, I'm a phone call away or an email away. You're going to get medicine that's really personalized. We're only going to have a small set of patients, so we're going to get to know you really well. That care is going to be convenient and there for you, and again, help you to steer you through the healthcare system, finding where medications and other testing you can do is the cheapest. So a little bit about me and our practice. So if you're looking into direct primary care, and you live in the Jacksonville area here, our practice is one of the few practices in the area that's doing this type of model. And a little bit about me and about what we do. So you're choosing me as a physician, and also we have a nurse practitioner who will see our patients and cover as well. Her name is Amanda Sulzberg. I'm physician. I have over 13 years experience in primary care, women's health, and pediatric care. I also am board certified in family medicine and sports medicine. So, prior to opening this practice, I was in Chicago in practice for 13 years. I worked at a residency program where we took care of anything from infants all the way to geriatrics. So I'm very familiar with covering the full spectrum of care. And then I did training in sports medicine, so and was a team physician for a professional women's soccer team. So I have a lot of experience in dealing with musculoskeletal injury. So again, I'm able to keep all that and help advise you on all that as part of the practice. I also add a holistic component to the practice. So I was trained in integrative medicine. I've done some functional medicine training, and I have training in acupuncture. And because I really believe in acupuncture, I offer patients who join the Premier membership 3 free visits to try it out. Certainly, if that's not your thing, we can stick to a conventional type practice. But if you're someone who's kind of looking at holistic options, or at least tipping your toe into them, it's something that we are able to discuss. I also do women's health visits. So I take care of a pretty broad spectrum of women's health care visits, from pap smears to vaginal issues to, all hormone replacement therapy. So we do a lot of those different types of things. Again, on the holistic spectrum, we do a lot of functional medicine. So if people have heard about that and are interested in, kind of talking about that and weaving that into what we do that. We do hormone replacement therapy here, and we do heavy metal testing, and we do a lot of nutrition and exercise consultations or discussions, and we weave that into the practice. And then we're looking forward to starting some exciting new things in IV nutrition and offering that to our patients in the coming year. So that's sort of, basically, a practice, in a nutshell, and all about, primary care. Again, it is, all of your visits are included, with this membership. So if you have an interest, if this has sparked your interest, in direct primary care, if you're someone who, kind of has said, this really sounds good to me, but maybe I have a few, individual questions. We offer anybody who is, interested to come and do a meet and greet. You can come to the practice, take a look at our space, see it for yourself, and then I sit down with you and chat about any questions or concerns that you may have. We also offer, excuse me, I'm going to grab some water. We also offer meet and greets over the phone. So should this be something that you are interested in and you can't make it, to the office, we absolutely do a meet and greet as well, so that you can kind of get to know me and decide if this is right for you. If this sounds like something that's just really good to you right now, you can certainly join, on our website, or give us a call. Anybody who's attended this webinar today, we want to offer you, a opportunity to waive your initiation fee if you sign up with us in the next 2 days. So if you call us or you sign up online, if you sign up online, you can use the promo code webinar. Again, that's a promo code webinar, and we will waive our initiation fee. If you decide that you want to do a meet and greet, give us a call tomorrow or send us an email at membership@balancedphysiciancare.com, and we'd be happy to set that up for you. So just to really quick go over our plans. So we have 2 plans. That's basic care, and a premier care. The basic care is me and Amanda, who take care of you. And it's really designed for people who really want that, feeling of having someone in their corner, someone who's personalized, but they say, hey, I really don't make it into the office that often. And so what we do is it's just $69 a month, and we just add some office fees in when you actually do come into the office. And then, if you decide you want to do a holistic medicine consultation or an acupuncture visit, the pricing for a basic member is much cheaper than for anybody who would do self-pay pricing in our area here at the practice. And then the Premier it includes everything. So, we just want to make it simple for those people who just are interested in the membership. They're interested in the holistic medicine, and they're interested in sort of the whole package. You can do the Premier Care. From the Premier Care, you primarily will just be me managing you, and then, Amanda sort of will help me out on weekends, call, or vacations when I'm away. So again, we also offer a family membership plan. So any adult who joins, we give them a discount. So if we have an adult and then a second adult that joins, we give you at a discount. And then if you have children, anyone under the age of 18, it's $69 a month. But if you have 2 or more children, we don't, and you have your whole family join, you, another adult, and then any children, the total price comes out to about a little bit over $300. So again, we love taking care of families, and we want to take care of your family. So thank you very much. Hopefully I've not rattled on too much, but have really given you the nuts and bolts about direct primary care. I really believe in it. I really have invigorated me to be able to take care of my patients in a way that I think people should be taken care of, to offer them the best care possible. I mean, when you enter our practice, you become part of our family. And it's our commitment, for me and our staff, to take care of you the best we can and make, your health our priority. So I don't know if anybody has any questions. Feel free to use the chat feature if you do have any questions. And I'd be happy to answer them. So I do have one person who asked a question about how much are medications. So medications are not included in the membership. That is something that you would pay for out of pocket. We have some prescriptions that we carry in the office that we have really cheaply. I mean, everything is $5, $10, $15 at the most to make it convenient. If I write a prescription, I use a prescription website to find you the most discounted prescription. And so, for people who are paying cash for their prescriptions, we try to use the generic medications as much as we can to be able to provide that cost savings. So prescription coverage is not a part of that, but again, we offer some prescriptions in-house and around the area that are discounted. So hopefully that answers your question. Anybody else have any questions? All right. So again, thank you very much for joining us here today. If you do have Any more questions, feel free to email us at membership@balancedphysiciancare.com, or give us a call. Be happy to chat with you. Again, anybody attending our webinar here today for the next 2 days, if you want to join, we will waive the initiation fee. You can just give us a call, and the promo code online again is just webinar. So thank you very much for joining us here today. And we look forward to seeing you. Have a great evening, and take care.